As the number of children diagnosed with autism spectrum disorder is rapidly increasing, the educational system is struggling to meet the needs of these students, and there's a lack of resources available to assist them. The need for continuous professional development in the field of autism is still important, despite a growing awareness among general classroom teachers about strategies that can ensure positive results for students with the disorder. Today, we'll talk about autism teaching tips for children and adults. In healthcare management, the management of health is often related to the strategies that are developed in order to provide assistance, guidance, to predict the progress of the development, and to minimize the risk of a health crisis. As far as neurocognitive problems are concerned, these are more likely to be required when dealing with them. The purpose of this video is to provide an overview of the role teachers play in the better management of children who have autism spectrum disorders. Autism is a neurodevelopment disorder that affects a person's ability to communicate, interact with others in a social setting, and respond appropriately to the environment. There are several special categories of disorders described as pervasive developmental disorders, including pervasive development disorders, Rett syndrome, pervasive development disorder not otherwise specified, autism, and Asperger's syndrome, as defined by the DSM-4 criteria and the International Classification of Diseases. Children with autism need to receive a special type of care, according to a study that was conducted. Ideally, this could be addressed using educational strategies under the supervision of a teacher in order to make the process more effective. Good manners and behavior of a student can be taught by an experienced teacher, for example. Using an organized day schedule was one way in which they were able to maintain a firm attitude while maintaining a well-organized day schedule. Teacher strategies that include one-to-one speech therapy are a good idea. While it's necessary for parents to receive special training in dealing with their children who have autism, the teachers could also create awareness programs for parents, emphasizing how long kids spend playing games. It can be recommended to busy parents that they hire old women who are caring and who will be more suitable for managing autistic children. As a result, they may be able to teach them a variety of angles, which is one reason why. There are various turn-taking activities that autistic children can participate in. For instance, roll the bottom ball or play ball with their hands. There is a possibility of preventing inappropriate behavior during mealtime for autistic children. It's therefore important that the teacher pays attention to strategies such as speech modulation, fun time, and strange manners at meals to assess the autistic child's ability to interact with the outside environment. In this way, educators could provide the child with the least restrictive environment possible. Next, when a parent is caring for their autistic child on a regular basis, they are often exposed to a lot of stress during the process. Research conducted by Dabrowska and Pasula examined the stress profile of parents of preschoolers with autism in order to gain insight into the relationship between coping skills and parenting stress. This study was conducted. The families were surveyed using a questionnaire. A number of parents with children who have autism were found to be under stress. The study also found that mothers scored higher than fathers when comparing parental stress between the two parents. As a result, parents and family members of infants and young children with autism may have to overcome stress and modify their coping styles in order to cope with autism. Children with autism who are in the preschool years need special attention while they exhibit behavior problems. An assessment tool called the Preschool Social Behavior Checklist was developed to distinguish autistic preschoolers from other children with similar developmental levels without having to assess social behaviors. In the early 5-year period, the teachers were able to review the information contained in the records under the achievement students achieved during that period. Using this method, it may be possible to assess the progress of autistic children's behavior. Specifically, this would shed light on the skills of imitation, peer interaction, and imaginative play, among other things. Thus, teachers are able to identify the social deficits that are intrinsic to preschool autistic children that may have implications for diagnosing autism and can instruct the care providers like parents and family members about these deficits. Before we continue, we'd like to ask for a few moments of your time. If you want to support Autism Answers and its mission to spread awareness about autism, please leave a like and click on the subscribe button. This would help us create more engaging content for you. Now, moving back to where we left off. Children with autism need to communicate well in order to receive the best care. As a result, teachers may be able to train parents in how to manage autism spectrum disorders so that their children can be able to communicate effectively with others. An experiment that involved young children aged 2 years old was conducted in order to train parents on the effectiveness of the rapid and delayed intervention programs during the course. This result was based on the vocabulary size of the children, their habitual environment, and their stress levels. For the parents' intervention group, it was observed that a good outcome had been achieved. It's therefore conceivable that parents could be better trained by teachers if they considered important factors such as vocabulary, ability of the child, diagnostic groupings, and the time gap between assessment strategies, which will play an important role in the training. It would be possible to achieve the desired outcome. However, if the parents were followed up by nearly 7 months after the training so that the parents could get feedback. Furthermore, assessing the interaction skills and development skills of children with autism is an important part of the teacher's job as a teacher of young children. Videotape observation can also be used to assess the impact of development on imitation and interaction in this example. As long as long time intervals of 1 year and 4 years are included in the age evaluation, It's possible to evaluate children quantitatively. Children could show a wide range of imitation and interaction levels at a very early age, depending on their development levels, which would result in differing patterns of imitation and interaction at a very early age. It may prove to be helpful for parents to cope with the development shortcomings of their autistic children by taking into account their developmental quotients in order to better cope with these deficiencies. Recent research describes a lack of research on early intervention strategies for infants and toddlers with Autism Spectrum Disorder, ASD. A number of factors might prevent teachers and parents from being able to provide their young autistic children with the best care possible. It was decided that a research strategy curriculum comprising of 4 interventions would be the best way to overcome the negative consequences of poor investigations. In this case, the focus was on time factors during the early stages of identifying the risk, emphasizing long-range targets rather than those involved in narrow-range targets, and tailoring the intervention to early toddlers' development background, as well as the parent's role in implementing an intervention that emphasizes parent coaching, sensitivity, and responsiveness to children's signs currently in progress. Developing intervention programs for preschool children who may have an autism diagnosis is extremely important for the teachers to be able to understand the effectiveness of diagnostic approaches and the efficacy of screening programs. There has been a lot of discussion in the literature describing the importance of special tools and checklists for autism screening in primary care settings, as described by Mull and Griffith, the researchers. For long-term and short-term population screening processes, 2 vital tools were utilized: CHAT, Checklist for Autism in Toddlers, and MCHAT, Modified Checklist for Autism in Toddlers. Based on a comparison of the 2 strategies, MCHAT showed better sensitivity but a lower follow-up rate for parents compared to CHAT. Autism occurs most often in children under the age of 5 and in infants younger than 5 years old. To conclude, it'd be more beneficial for teachers to use the mentioned research-based screening strategies to better implement their instructional and intervention skills in order to better protect young children living with autism. These strategies could be taught to parents in a way that is evidence-based, as these strategies were taught by the teachers. As part of the curriculum of their educational awareness program, preschool children and toddlers need parents and families to be instructed by teachers on how to facilitate parent and family-based interventions. Taking this approach might be able to help to overcome the defects adopted by caregivers in the early stages of a child's development with autism, perhaps even during their childhood years. And that's what we have for you today. What are your thoughts? Let us know in the comment section down below. If you want more content related to this topic, make sure to check out our channel. Take care, and we'll see you in the next video.